Welcome back, beloved. Today we're continuing our conversation on pelvic pain and mental health and why the correct support matters.
Pelvic pain is a source of depression for many women. And in conjunction with postpartum depression, it can become a severe problem because depression would continue to feed the pain and it becomes a cycle. Depression, pain, and it crescendos into something that becomes unmanageable if you do not seek assistance. People have difficulty with bowel movements, become constipated, have problems with sexual intercourse and intimacy, develop scar tissue from episiotomies or cesarean sections, and then have other issues such as difficulty sitting or even just difficulty having a comfortable rest. It can lead to headaches, all sorts of other symptoms that you may not necessarily tie into the pelvic pain. However, it's a source of power as well as healing for women. And we need to make sure that we take care of our pelvic health.
And speaking more on pelvic health, because we're going to get a little intimate at this point when it comes to sexual intercourse, because sometimes things change after you have a child.
Right.
And like you mentioned, episiotomies. When you're giving birth or when you're at the hospital, sometimes a lot of things aren't really shared as far as the cons of such normal, what they call normal medical procedures. I've heard many different testimonies as far as that area not healing properly because, let's discuss an episiotomy first of all. Oh, go ahead and explain episiotomy, doctor.
An episiotomy occurs when the birth canal is not opening, not the canal itself, but the opening where the baby is crowning. If it's not expanding sufficiently, sometimes the physician would put a cut, that's called an episiotomy, in the pelvic floor, in the perineum. And that would be stitched or left to heal on its own, depending on the depth or the length of it. Other times, the female can also tear, and that can also be left to heal on its own, or it can be stitched. Now, those things require care after, and there are also things that can be done prior to going into labor to ease the burden or to prevent that from even happening or lessen the severity of it. And that goes into why having a doula is also important, because you have a lot of preventive tips that your physician may not dive into with you, and you have personalized care to address your specific issues ongoing throughout your pregnancy versus just waiting for your periodic visits with your physician.
And then too, with the episiotomy, we're now going to pull in the mental or the emotional part of that, because as I mentioned before, there's some testimonies that I hear from clients about when it's being stitched up, or sometimes the sensation is a little different. It kind of equates to a trauma that's not really dealt with, because again, some of the cons aren't discussed, especially if you don't know. Sometimes you're just unaware. But a lot of times, even having sexual intercourse after you've given birth, and it's this episiotomy that you had and the perineum is still trying to heal, there are different techniques that I don't think women are aware of, where physical therapy goes hand in hand with that. So yes, mentally it's a block there because of a physical
impairment.
Thank you. And so, like I said, Venné, I know Dr. Venné, I know you took different trainings as far as pelvic floor health and how that certain treatments that you do. I know
one of the things that happen when a woman has an episiotomy, like Natasha was mentioning, the trauma syndrome that you develop, or some people can develop, is tied to just using the restroom, having intimacy with their significant others. It's like repeating the trauma over and over. So that becomes a limitation in a female's life, because intimacy is a natural part of life. Using the restroom is a natural part of life. If you can't sit comfortably, you start to shift your weight, your spine, your pelvis, everything becomes uneven. It can then further lead to neck pain, curve in your spine that you didn't have before. And, we develop a sequela of issues, a domino effect that we could prevent or take care of prior to it happening. The trauma also can affect your emotional bond with your child, which is a problem that many women have and don't even know it. And that's a different topic for another day. We have mother wounds and we have the different things to touch on in the future. But, these are all important things that as a community we need to be educated on.
For sure. And then having that support again, especially women of color. We already know what the dynamics look like when it comes just to the type of care that we receive. And so a lot of us suffer in silence because we think we have to be this strong, independent woman. And I don't know where that narrative started and why, because we're social beings. We need one another. There are things that she may know that I may not understand or know, and where that healing goes hand in hand, because there are times where we think we should know again. And well, my mama told me this and my daddy said that. And so you go on things just passed down that could be incorrect. And so you just learn to shut up and deal with it.
Right. And sometimes, we believe that is our responsibility because that's the way we were taught. And sometimes we were taught incorrectly. And we can make a shift to change that. And it starts with education. And that's why we are here today.
Right. Because it's a lot of things too. I know we're making more of a point on pelvic pain, but now the mental side of that, the mental side of, I like how you mentioned it is a cycle that keeps going around and around, because I'm having pain somewhere in our bodies, not necessarily if it is your pelvic floor, but just if you have a headache. I might not be sociable today. I may not be able to do my everyday activities. So know if pain affects you in that way, how much more so something a little more intimate as far as
in
your
a
pelvic
sensitive
floor.
area.
Right.
So support system is also important. Sometimes you may not feel comfortable speaking to your medical team, but if you have a strong support system, they can assist you in doing so, accompany you to your physician, nurse practitioner, midwife, whomever you're seeing, physical therapist, and communicate these issues, these problems, these symptoms. Do not ignore your body. Do not ignore your symptoms. They are real and they can be treated.
Right. And again, support. There's no reason why in this day and age we're going through things by ourselves. I know some of us are very private, but if you can't, rely on a close friend, they have medical professionals where by law they can't really go and spread your business. So there's really no reason for you to have to try to learn motherhood by yourself or experience or go on a healing journey by yourself, because what we've been taught could sometimes be wrong, where you have professional support, professional help that can get you along the road to recovery.
Right. And at Temple Works, everyone that knows me knows that I am very confidential and private, and that you will feel safe and comfortable here.
And even in friendship, when I say Dr. Venné is, you won't know anything about someone else, even if she has a problem with someone else, because again, that's just your heart, that's just your integrity, your work ethic. And in this day and age, sometimes that's far in between. But when you find a doctor and when you find care where you can confide in that individual, again, the mental portion goes hand in hand with the physical.
Yes.